So I get asked a lot about TMJ problems. And it's honestly one of my favorite things to work with because it responds so well to chiropractic care, especially what I do. And I hear it from a lot of patients. Like, we'll be talking and they'll be like, Dr. Mike, I didn't know you helped TMJ problems. Why didn't you tell me? And so I'm shooting this video to explain a little bit about what I do, how I help, how chiropractic helps with TMJ issues. So if you're suffering from that, this is definitely what you need to watch. And then I'm gonna have a little call to action at the end. We need to get you in, let me check you out and see if I can help. A little bit about me. My name is Dr. Mike Geran. I am at Foothills Chiropractic here in Travelers Rest. And I've been a chiropractor since 1997. I have owned and operated Foothills Chiropractic here in Travelers Rest since 2010. I'm on North Poinsett Highway, just down the street from Leopard Forest Coffee. I think it's one of my favorite coffee shops on the planet. If you know where that is, I'm just down the street from Leopard Forest. I've been doing chiropractic for a long time, and I didn't graduate school knowing what to do with TMJ problems. I went to a school that really only focused on the spine, and that was great. I went to the best chiropractic school there is, but they didn't do a lot on shoulders, elbows, knees, hips, and TMJ problems. So I went to work for a guy in Columbia, South Carolina, Dr. Rob Bigby, great guy. I think he just retired. And he taught me a lot about how to adjust things that weren't on the spine. Shoulders, knees, hips, elbows, and TMJ. Once he trained me on TMJ, I've been really good at working on TMJ since then. So I have Dr. Bigby to thank for that. I wanted to just shoot this quick webinar to just kind of go over how do I help with TMJ problems. And if it speaks to you, then you should definitely give me a shout and we'll get you in and get you looked at. First of all, there's some myths that I wanna try and bust about TMJ. I've heard it from patients. I was just told I had to live with it. They said there's nothing I can do. I just kind of have to deal with it. Eat small bites. Don't eat big, giant sandwiches, and just kind of deal with it and manage it because there's really not much to be done. Other people I've talked to have said that they were recommended these either really expensive appliances that they have to wear to help correct or help manage the symptoms of TMJ, or they have to just do a ton of therapies and different things. And the reality is, you don't have to do any of that. You don't have to do any of that stuff. 9 out of 10 times, probably more than that, I can help with TMJ. I've been helping it for a long time. Here's how I help with TMJ problems. It's pretty simple. There's a few things that are gonna happen when you come in. First, we need to do an evaluation to see if you're in the right place and if I can help. Then we need to do an exam just to check a couple things. First thing we're gonna do is we're gonna check the spine because especially the upper part of the neck up here, it ties directly to the jaw. So when you have dysfunction, abnormal mechanics, abnormal motion in the neck, it's because there's so many muscle attachments here into the skull, into the jaw. It can very often just clearing the spine, getting this area moving better, very often that's going to help a lot of TMJ problems because there's just such an intimate relationship between the jaw and the skull and the upper part of the neck. That's the first thing. Second thing is we do a very unique technique in my office called the zone technique. And what the zone technique does is it actually balances the brain and it balances the nervous system. And a balanced brain and nervous system is going to do a fantastic job of healing just about everything. So if we can balance the brain and nervous system, that's half the battle right there. We do the zone technique very often. That'll also involve adjusting something in the neck. And we do it one of two ways. We do it with my hands. We do manual adjustments. I also do instrument adjusting using a device called the Pulsar. It's a computerized adjusting system. I know there's a lot of people that are maybe a little freaked out about getting manual adjustments, especially the neck, and I get it. So I use the Pulsar for the majority of my people, and we get great adjustments using an instrument. We get great balance, get great results with it. So, zone technique, clear the neck, that can help the jaw. get the body working better. It's going to be in healing mode. It can help heal the jaw. Second thing is we will actually look at the jaw itself. Check the alignment of the jaw, because very often when there's a TMJ problem, the jaw's misaligned. So it's off one side or the other. Evaluate it. If I find that the jaw is misaligned, again, either with an instrument or with my hands, we will very gently help get that jaw tracking normally again. And it doesn't happen in one visit. It usually would take some time and repetition. But if I keep doing my thing and we just keep working on slowly getting it moving better and better, opening and closing better, lo and behold, we're gonna see good results with it. And then lastly, very often there'll be a lot of tension in the muscles in the above and below the jaw. So I have a device called a vibrocussor. And what it does is it actually releases the fascia, which is the covering of all the tissues. And if we can release the fascia, it's a real quick, easy, gentle thing. It's a little vibration we do. We release those muscles with the vibrocussor. We see that can kind of like be the other missing piece. So we hit it from a bunch of different directions, super gentle, super easy. And I got to tell you, I get great results with TMJ problems. So if that's you, the next step is this. It's very simple. Book an appointment, come in as a new patient. If it's a good fit, then we'll talk about working together. And it's usually a series of adjustments. It's not usually a one-shot deal. It usually takes some time and some repetition. And we've got to give your body time to heal. And we've got to do consistent checks and adjustments, because it's a step-by-step process. It usually takes time. But I know that if somebody comes in and we check their jaw and I can help, I know we're going to see great things happen. Again, I'm Dr. Mike Geran from Foothills Chiropractic. Click the link that's in this video. Book your first appointment. You're going to do great. So anyways, thanks for taking the time to watch this, and we'll talk soon.